Welcome back, viewers, to Faith and Discipline podcast. Our topic today is rheumatoid arthritis, and our guest is Dr. Masroor Ahmed, who is consultant rheumatologist. Welcome, Dr. Masroor Ahmed, to Faith and Discipline podcast.
Thank you for giving me this opportunity to talk on this forum.
Let's begin. Our first question is, what is rheumatoid arthritis and what are the symptoms?
So this is a common question that I'm asked by patients and also their families. So rheumatoid arthritis and osteoarthritis are entirely two different conditions. Rheumatoid arthritis is an autoimmune condition, which means that your immune system starts attacking your joints, causing inflammation, and patients complain of pain, stiffness and swelling due to inflammation, and loss of function as well. Osteoarthritis, in general terms, is a wear and tear type arthritis, consequence of life and work. For instance, people can have osteoarthritis in the knees, but without swelling. It can cause pain mainly, but we don't expect swelling in osteoarthritis. It can sometimes cause mild stiffness, but stiffness is not significant.
So what is the reason behind getting this disease? Why people get rheumatoid arthritis? Because as you mentioned, osteoarthritis is due to wear and tear with age. So what's the reason behind?
So rheumatoid arthritis, we don't know the exact cause, but we know that there are certain triggers. For instance, sometimes infection can trigger inflammation in the body, and some environmental factors. For instance, if you smoke, you're at high risk of developing rheumatoid arthritis. Osteoarthritis, because we use our joints, all our lives. So they're prone to wear and tear, more so in people who play sports or had an injury. For instance, if someone had a meniscal injury due to playing football, they will be at high risk of osteoarthritis, and the risk increases with age as well. Rheumatoid arthritis can affect any person of any age. Older patients can also get rheumatoid arthritis, but you can differentiate between osteo and rheumatoid with the symptoms they present you with. For instance, they will be very stiff. It affects smaller joints initially rather than bigger joints, and the joints can be stiff and swollen. For instance, a typical example would be a person with rheumatoid arthritis will usually have inflammation and pain in both hands. But osteoarthritis usually affects one at a time. They can have arthritis in both joints, which is usually larger joints like hips and knees.
So which one is more difficult to treat? Is it osteoarthritis or is it rheumatoid arthritis?
It depends on the symptoms. So rheumatoid arthritis treatments have improved considerably. When I was a trainee or a medical student, there were not many treatments available for rheumatoid arthritis. But because of research, we have a lot better treatment for rheumatoid arthritis. It's not curable, but it can be controlled very well with medications. Osteoarthritis, unfortunately, there is not much medical treatment at the moment. If it becomes very severe, then patients end up having surgery, especially for knees and hips. But there are other measures, conservative measures we call them. For instance, injections and some medications which can control their symptoms, but it will not alter the natural progression. But rheumatoid arthritis, we can halt the progression of the disease with treatment. So because it is an inflammatory condition, medications which control the inflammation, immunosuppressive medications we call them, can control rheumatoid arthritis very well, and most of my patients are living normal lives.
So can we say the osteoarthritis is more likely to happen in older patients, but rheumatoid arthritis can happen at any age?
In general terms, you can say that. So more older you are, more at risk you are to develop osteoarthritis. But remember, patients who have rheumatoid arthritis, they can also develop osteoarthritis if the inflammation is left untreated. For instance, they can get damage in the joints if we don't treat the condition. So I think it's very important to diagnose rheumatoid arthritis early, because then you can control and manage the condition and stop patients from developing damage or osteoarthritis. It is very important to distinguish between rheumatoid arthritis and osteoarthritis because the treatment is entirely different for both conditions. So rheumatoid arthritis can develop at any age. Osteoarthritis is more common as we get older. Okay. Or if an athlete or someone who had risk factors for osteoarthritis due to wear and tear, they can develop it slightly earlier. Mm-hmm. But in general terms, it develops later half of the life.
Some people believe there is a link between diet and rheumatoid arthritis. Is it true?
It is partially true. For instance, if you are overweight, then you are at more risk of developing osteoarthritis in your knees and in the hips, because the joints have to bear the weight of whole body. And also, if you have high cholesterol and if you smoke, you're more likely to be obese. Mm-hmm. So the diet is important. So healthy diet, low cholesterol diet is very important to lower the risk. So yes, but obviously it's not an absolute risk, but there's a link between diet and developing arthritis.
Is rheumatoid arthritis just like a pain in the joints, or can lead to serious health conditions?
That's a very good question. I think there is a lot of misinformation or lack of information about this, even amongst doctors. So rheumatoid arthritis affects 2% of the UK population. I'm not sure about the other countries, but it's very important to remember it's a systemic disease, which means that it can affect different organs of the body. The way it causes inflammation in the joints, it can cause inflammation in the lungs, causing scarring of the lungs, which can have a huge impact on someone's survival. It's important to know. It can also affect the heart. It can cause swelling around the heart, and also it can affect coronary arteries. So those patients who suffer from rheumatoid arthritis are at high risk of developing heart attacks. So one of the risk factors. And also it can cause vasculitis, which is the inflammation in the blood vessels, and also nodules. So, and dry eyes and dry mouth. It can damage vision if you develop inflammation in the eyes. We call it scleritis in medical terms, which is inflammation in the eye. So it can patients can get blind. So if the patients are treated, all of these complications and ill effects can be controlled.
So if it can cause a heart attack, can it also cause brain stroke?
We don't have much research to suggest that with confirmation, but there has been research on heart attacks. You would probably suspect that it will be a risk for developing stroke because of causing high cholesterol.
Because it's the arteries are becoming narrower, so it might cause flow of the blood to the brain as well.
That's correct.
So is it a manageable disease, or it can be cured permanently? Because some of the diseases patients, they have to just manage for the rest of their life. So is it like one of those diseases they have to manage for the rest of the life, or is it curable?
So rheumatoid arthritis is not yet curable, but I think it's on the verge of being cured. So it can be controlled very well with the medications.
Okay.
So with immunosuppressive medications, the survival and the risk of damage to the joints has reduced significantly. Okay. So it's important message that any patients who are suspected to have rheumatoid arthritis, they should see a rheumatologist, because early treatment, early diagnosis would improve survival and also will reduce disability.
Is it mainly happens in male patients or female patients?
It is known fact that it is more common in women than men. But when men develop rheumatoid arthritis, it's called poor prognostic factor. I mean, they get it very bad. So it can affect both men and women, but it's more common in women.
Okay. So most of the diseases, they are linked either with diet or lifestyle. So when we talk about rheumatoid arthritis, is it diet or is the main culprit, or is the lifestyle?
Rheumatoid arthritis, as I said, it's an autoimmune condition where your joints can be damaged because of the inflammation. So it can happen without these risk factors,
Okay.
but we know that those who smoke and who have less healthy diet, they're at higher risk.
Okay. Does it reduces the quality of life if a person is a sportsman and they have osteoarthritis or rheumatoid arthritis? Does it interfere with their lifestyle, or they can carry on their life as normal?
Absolutely, it does. I mean, it is a disabling condition. Rheumatoid arthritis, as I mentioned earlier, can affect hands and feet more commonly. So if your hands are affected, you can't do anything. You need your hands to do everything.
Yeah.
To drive a car, to even wash and dress yourself. You need your feet to walk. So it will massively affect their sporting activities and their day-to-day life if not controlled.
So if someone is like experiencing stiffness in their joints, anywhere in the joints, do they need to just observe it themselves and see how it progresses, or do they need to see the GP straight away?
So we say that if someone has pain, swelling and stiffness in the joints, and if it doesn't settle down within 4 to 6 weeks, they need to see a GP.
4 to 6 weeks.
Then yes.
Okay. Is there a link between rheumatoid arthritis and depression and anxiety?
There's a massive link.
Okay.
There's a massive link. So we know that those patients who have anxiety and depression, they don't do well with management of rheumatoid arthritis, because imagine if you can't use your hands and if you can't walk, you will be depressed.
Exactly.
So if you can use your hands and if your mobility is good, then it will have an impact on your depression. You will be less depressed. So there is a link both ways. Anxiety and depression can also make rheumatoid arthritis worse, but rheumatoid arthritis can also cause anxiety and depression.
Okay. So it's a two-way thing.
Yes.
Anything can start first and then it can cause the second one. So how do you diagnose the patient, whether the patient is really suffering from rheumatoid arthritis?
Again, it's the symptoms.
Okay.
So I'll give you a typical example. It doesn't fit anyone, but for instance, rheumatoid arthritis usually affects hands and feet initially. Someone who has pain, swelling and stiffness in the joints, which means that they can't make a fist when they wake up in the morning. They can't walk due to the pain and swelling and stiffness in the feet, which can last for more than half an hour. So a rheumatoid arthritis should be suspected and they should be referred to a rheumatologist. It's very important to see a rheumatologist because they have to do certain tests to make a diagnosis.
Patient's life, if they're suffering from rheumatoid arthritis, flare-up is the thing they're really scared about, because when they have a flare-up, then they can't even move, they can't do anything, and their life is standstill. So if someone experienced that type of situation where they have a flare-up, what is your advice, what they need to do to relieve their symptoms?
So initially, they need to seek help from the doctors. So someone who already suffers from rheumatoid arthritis and has a flare-up, we can control the flare-ups with certain medication like short-term steroid, and also change their medications and also escalate their medications so that those flare-ups don't happen again. So it's very important to prevent them. So initially we control them, and then we also prevent them with definitive treatment like immunosuppressive medications.
Okay. So as you mentioned before, like it is linked with inflammation of the eyes, with inflammation of the lungs and the mouth as well. So if patient suffering from any of these conditions, like they feel like they have experiencing difficulty in breathing, or even the swelling in the mouth or the eyes, what they need to do? Do they need to take any medication straight away, or do they need to seek help from emergency services?
They need to seek help either from the GP or emergency services, and needs to be referred to a rheumatologist, because there are lots of reasons which can cause these symptoms.
Okay.
So it is a job of the rheumatologist to link them to their rheumatoid arthritis, or whether these symptoms are due to other cause. Okay. And those who are linked to the rheumatoid arthritis can be controlled with medications.
Next question is, it'll be a bit a tricky situation there. Is like if the patient moves, the joints hurt, and if they don't move, the joints will become worse. So what exercises or what type of movements do you normally recommend to patients to do so they don't feel the pain and then they carry on with their life?
I think it's very important to exercise,
Okay.
even with rheumatoid arthritis.
Okay.
So we teach, through our physios, we teach patients to do muscle strengthening exercises. For an example, someone who's got rheumatoid arthritis affecting hands and wrists, so they can do grip strengthening exercises.
Okay.
And because if you don't use, then the muscles become weak.
Yeah.
So grip strengthening exercises are important. Once their inflammation is controlled, they will be more active and they will be able to do exercise. So this is why it's important to diagnose this condition early.
Other than that, do you recommend hot or cold therapy to relieve the symptoms for patients?
You mean massage therapy?
Some people use heat like a hot water bottle or, cold packs to relieve the pain in the joints. Does it work?
It can be used temporarily. But again, as I said, it's important to treat the cause rather than the symptoms, because if you just treat the symptom and not the cause, then it will keep coming back.
Exactly.
And if you don't control the inflammation, with time it will damage the joints.
Joints are damaged, then obviously they need to go for a surgery, for a replacement, and there's nothing else can be done. So what is your overall recommendation? What patients need to do? Improve their life? And the people who don't suffer from rheumatoid arthritis, and how can they prevent from getting this disease?
So healthy lifestyles and exercise is important. Majority of people say, exercise 3 times a week for at least half an hour, an exercise which can make you sweat.
Okay.
And also low cholesterol diet is important.
Okay.
Try and reduce the cholesterol intake and sugar intake if possible, for a healthy lifestyle. And most importantly, the take-home message is, if you have pain, swelling or stiffness in the hands and feet, see a rheumatologist as soon as possible.
As soon as possible. That's been very useful. Some people, they don't like taking the conventional treatment route. They prefer having a herbal treatment, alternative treatment methods. Are there any proven methods out there? Do you know of any?
No, I'm afraid there hasn't been any research, and from my personal experience, I haven't seen any dramatic effect on herbal medication. Healthy diet and exercise does improve symptoms, in addition to the treatments. So they both work better together. Some people have mentioned turmeric, because they have anti-inflammatory properties, but it's probably more for osteoarthritis. There hasn't been any research done. So majority of research has shown that controlling the inflammation through medications, in addition to regular exercise and diet, will improve the prognosis and the survival of patients.
Thank you very much, Dr. Masroor Ahmed. Thanks for joining us today. It's been very, very useful. Thank you very much.
You're most welcome.
Thanks, viewers, for watching this podcast today. If you find it useful, you can share with family and friends, and you can subscribe to our channel. We intend to do our podcast live in future, and we will take your questions and try to help you as much as we can. Thanks for watching.